Well, the science is clear. Pap smears save lives, but how often do you really need one? Dr. Timothy Quinn practices family medicine in Ridgeland. He joins us now live at the desk. Dr. Quinn, first of all, what are pap smears used for?
Well, basically, pap smears are ways that we medical providers screen for cervical cancer. I mean, we use the speculum to assess the sample, and we send it to the lab, and we can notify the patient if they are at risk or if they have cervical cancer, which can save a person's life.
That's very important stuff. How old does a woman need to be before she starts getting pap smears?
Well, it's funny you asked that. I had a patient just last week. She brought her teenage daughter in, and she was very insistent that I do a pap smear, and I told her about the new guidelines. I mean, these new guidelines have a lot of people confused.
Yeah.
I mean, most women think that you should get a pap smear every year, but according to the United States Preventative Services Task Force and the American Congress for Obstetricians and Gynecologists, they're now saying that we should do a pap smear every 3 years, starting at age 21 through 65 years of age. Now, for women that are 30 years old, they can opt to get a pap smear every 5 years, but they have to get an HPV test with that pap smear every 5 years. And this HPV stands for human papillomavirus. It's actually a sexually transmitted infection that can cause the cells of the cervix to convert to cancerous cells.
That is scary stuff. How common is HPV? It's pretty common, isn't it?
Oh, yes. I mean, some sources say that it's greater than 50% of the population of females in the United States, and some even have cited up to 70 and 80%. So it's a very common infection. That's why it's so important that, you know, if a woman gets a pap smear and it's abnormal or suspicious, we'll automatically go ahead and do the HPV test, and that'll help us guide our, it's sort of like helps us guide our treatment as far as what are we going to do about this pap smear.
Why is it longer between tests now than it was in the past? Why are they saying you go ahead and you can wait 3 years, you can wait 5 years? What's the science behind that?
Well, what they discovered is the cells in the cervix, if they become cancer type cells, they grow very slowly. And also the pre-cancer cells, it takes quite a while for them to develop into cancer. So what the scientists have recognized is by screening every 3 years, there's time enough to catch it and go ahead and remove those cells and treat the patient, and the patient is fine. So basically, there's no need to do it every year because the cells are so slow growing.
Oh, that's good to know. What if you have a family history of cancer or anything like that, that are special circumstances where the guidelines would not apply to?
Most definitely. And that's why it's so important that even though women are now asked to do a pap smear every 3 years, it's still a good idea for women to go every year, because what it does is it allows the woman to talk to her medical provider and go over the history, and also to note if she's had an abnormal pap smear in the past. That way the guidelines would change for that specific individual, where she might have to get it every year because of her history. But also wanted to note that there's a lot of concern in the medical community. A lot of medical providers are worried that people will think, well, now I just go every 3 years, but we really encourage everybody to go every year, because during a physical, we also check the height and weight, we check the blood pressure, we check the cholesterol. All these can lead to heart disease or even death, but also we check diabetes and also psychological assessments for depression or anxiety. So it's so important that every woman go see their medical provider every year.
And what if you don't have insurance? There's a number you can call out there?
Yes, there's a program with the Mississippi State Department of Health. It's 1-800-721-7222. That's 1-800-721-7222. And it's for a program where you can go and be screened for cervical cancer with a pap smear at no out-of-pocket expense and get a mammogram. And if it's determined positive, there are resources where you can follow up, and even if you need surgery, you can get that potentially life-saving surgery, and save a life.
That is wonderful to know. Dr. Timothy Quinn, thank you so much for stopping by today. The topic was pap smears. You don't have to get them as often, but you do need to get them every few years. We'll be right back.